So, Miss Kimberly, how was your day today?
I had a good day today. I did not go to work, so that was part of the reason it was good. No, I had to take the day off because I had a dentist appointment today.
Yeah.
So
I do not like to go to the dentist.
no, yeah, that's part of my journey with the dentist. Is I used to be. I'm very anxious about lots of things, and I was really anxious about going to the dentist. So I went to the dentist last year for the first time in like 8 years.
Yeah.
So it had been a long time.
I totally understand that. I mean, I've been to the dentist regularly, but I've had a lot of trauma as a child with the dentist, and it's definitely has like now impacted me as an adult. So there's that. So I love to hear how you feel if you want to share.
Yeah, I actually last summer just kind of like went through a whole like I need to take control of my life back kind of situation. So I like went to the doctor for the first time, the dentist for the first time. I go to Dental Depot. Have you ever heard of it? It's like a train themed dental office, and I'm
A train,
like a
choo
choo. Yep. I'm fairly positive that it's meant for children, but the whimsy makes me less anxious.
Yeah.
And the dentist there is really nice, and so I went for the first time last summer, and it was like a whole production, like the gums and the teeth and the deep scale cleaning and all the things. And so now I get to go every 3 months until I graduate from every 3 months.
Okay.
So that was today.
I think that was a hard thing for you to like. I imagine, I guess in my own experience, like just to take that step to go to the dentist, but like you kind of don't know what to expect. How did you feel about that?
I don't think like as a child, like going to the dentist wasn't like super prioritized in our house, which is interesting because my mom was a medical professional, not a dental, but medical. So you would have thought, but so I guess I like didn't think it was a huge deal that I wasn't going. So like once I got married, it just like wasn't a thing I did. But I decided to go just because I was grinding my teeth at night. So going back to the anxiety.
Oh yes.
So I was like, I need to get a mouth guard. And that's ultimately why I decided to go back.
Okay, so funny thing is, I've been told I have a crossbite and an underbite. Yeah, so that's caused another additional trauma to the right side of my mouth. But that's the thing. I think dental is so important, but we don't really focus. I don't know how to say it. Like when I say we, I'm kind of generalizing, but like dental care is so important, and that's one thing that I regret. I wish I took better care, but also, anyways, that like it's kind of not. It's like it's not as prioritized. I don't know. Yeah. Anyways, like whether that's in the household or brushing your teeth or flossing. I think a lot of people don't floss, including myself. And it's like the basic thing that's so important for like gums and all of that. So I've been told probably the last 6 years, you need a mouth guard. You need a mouth guard, and I just push it like, hey, my teeth are fine. I don't care. And come to find out, that's why now I have Invisalign, but it's not even for aesthetics. It's for slowing down my progression of my periodontitis, which has been pretty serious. So after my pregnancy too, do you know that like in pregnancy that really affects
it affects your teeth.
That it's kind of really going downhill right now. I've lost a lot of bone density, and but I'm really proud of myself because I've kept it up the last 2 years, and I'm seeing it's irreversible in a sense too. So like whatever you do now to be proactive for the future.
Yeah, I am also proud of you because I know that going as much as I end up having to go, like every time I'm like mentally like, okay, I have to go to the dentist. I have to keep doing this, and it's like, is there payoff? I have like questions about what you said though. I heard you say you have a crossbite. What is a crossbite?
So crossbite. So our natural bite is like this. So this is.
I don't know that mine is. I think mine's more like.
So you might, if it's overextended, it's an overbite, the underbite. But a crossbite is when your bite doesn't align.
Okay.
So mine's like this.
Oh, interesting.
Yeah, and then so what they're trying to do now is align it. But I've had a lot of teeth pull, some of like my like molars, because there's another thing too, Kimberly. Like, you know how much it costs. Like insurance, it's not generous to cover like medical care, but like. When I was in college, I had no insurance. They're like, well, you need a root canal. And I'm like, well, how much is that? 1,000, 1,500. I can't afford that. Pull that teeth out. And I did that. And it just all kind of accumulated, and like I'm
Mhm.
where I am now. But as you know, it's never too late to, like you said, take my
Yeah.
life back.
Yeah, I know
But
that sounds dramatic, but
no,
it
it
was
is
it
not
was like very much
dramatic.
like a transformative, this like Debbie Downer, but like I think I mention this every week. I'm so sorry, guys. Like my brother passed away in 2021, and my dad passed away in 2023, and I was just kind of like spiraling in a place where I like wasn't taking care of myself,
Yes,
and so I ended up like I stopped consuming alcohol, and then I was like, okay, I need to
I
like
saw that.
thank you.
Yes,
Yeah.
it's
I
amazing.
so after that I just cuz like what do I need there's so many things I need to do to be able to like be present for my own child. And so that's when I like went to the doctor and started working to lose some weight, go to the dentist.
Yeah.
And so but yeah, I went today and the train flew by and he was super he always tells me how proud of me he is, which like I think I just need words of affirmation from my dentist because you couldn't tell me nothing after that appointment. I was like, he said I'm good. I got no cavities, that I'm doing a great job. My x-rays look good. And so I was proud of myself. So I do think it takes work to like be consistent with it. So I
Yes.
think it's a big deal that we're both doing that. So.
Yeah, and I get this is in my experience. It's like I've always felt embarrassed for a long time. So then that
Mm-hmm.
adds to the anxiety, and then you're like, well, I don't want to go to the dentist because I don't want them to tell me, well, you're not flossing and you're not
Mm-hmm.
doing a good job, you know. And so that was a big part of my anxiety. But like I just come to accept that like if I want to prevent this from worsening, I have to take care of it. So
Yeah.
my sockets are doing good. They're like in the twos and threes. So you know,
Mm-hmm.
like on a scale of 1 to 4, like what does that look like?
Mm-hmm.
Teeth mobility. Like I've and it's been empowering because I'm learning a lot more about gums and teeth than probably a
Mm-hmm.
typical person would know.
Yeah, and you say all these things, and I'm like, oh, I know what that means.
Yes,
I know what the
see?
gum density and stuff is. I know what
Yeah.
that means because we're, yeah,
Scaling or like
yes,
deep
the deep
cleaning.
scale cleaning. Yep.
Yeah.
Now you had to numb your mouth, and like,
Yes.
yeah, that was a really interesting. They did one half of mine at a time. It was a very
And then
interesting
you look like a
experience.
chipmunk for
Mm-hmm.
half of a chipmunk. But now I need some gum graft. Have you learned
No,
more about
I
gum
I
graft?
didn't have to have a gum graft done, but
Yeah.
that sounds. I know what a skin graft is, so
Mm-hmm.
I assume it's same premise.
Yeah, so like my gums are receding so much from the bacteria that they have to the procedure is just taking tissue from the top of your mouth
Okay,
and then
putting
basically
it.
stitching it
Okay.
onto where it's at so that it can help the gums realign. And then but you know, diet's a big thing,
Mm-hmm.
mental health is a big
Yeah.
thing, and just good dental hygiene. I feel like my hygiene is good. I definitely don't floss, but a water prick has been like my best friend.
Yeah,
Yeah,
I have never used a water pick. I'm not sure why. I try to floss, but I just use those like the
yeah,
stick ones,
yeah. The
or
one.
whatever, because the idea of having my hands in my mouth also kind of grosses me out. It's interesting that you said mental health though, because it wasn't until after I went and got my mouth guard. Did you get a mouth guard?
No,
You
I
haven't
never.
yet. You need to get one.
Well, my dentist basically said, I don't know if I can do your mouth guard because I'm afraid that it's so tight it pulls out. It might pull your wiggly
That's
teeth.
so interesting.
He was really concerned about my wiggly
I mean,
teeth.
that makes sense though. They don't want you to lose the teeth you have. But after I got my mouth guard, it wasn't until after that and like talking to the dentist about how anxiety like can manifest itself in your sleep that I
Absolutely.
went to my primary care and was like, "Hey, girly, I think I might need to be on something." And so then that's when I started taking anxiety medication
Yeah.
and like trying, and that has really helped regulate. It's interesting. I was just telling my dentist today though, I was like, in the last couple weeks, I feel like I've been grinding my teeth more, and he was like, "Girl, the world is stressful."
Yeah, this is you know
He's a Middle Eastern man, and
okay.
so he was like, "The world is stressful right now," and I was like, "No, you're right. It is. It is. It is." So that's probably why I'm grinding my teeth. It's fine.
I
So.
feel like your dentist is like a sense of empathy and really prioritize the feeling of ease and
Yes.
comfortability. Yeah.
I have really tried in my adulthood something that I like as a child never really noticed was like the type of person, or, and this maybe will sound interesting, but like the color of the person
Mhm.
that is helping me do things.
Mhm.
And as an adult, I've made like conscious choices to be seen and get medical care from Black or brown providers,
Yes.
because, and I found in my personal experience, and not to generalize, but I found that every provider that I have had that is Black or brown has been way more empathetic and like in tune with my needs and
Mhm.
emotions when I come in feeling like anxious or having questions. So
Wow, that's
yeah,
Yeah.
I talk to my husband about it a lot because, like, as a kid, you can't really choose, who your dentist is, who your doctor is. But now, as an adult, my primary care, my OBGYN, my dentist, my everybody is black or brown.
While you're saying that, I'm thinking about how like,
What yours look like?
okay, so we talk about the the gum disease piece, but like how it contribute or manifests from like chronic illnesses. So
Mm-hmm.
I recently got diagnosed with diabetes type 2, and I was doing more and more research about it, and it talked about like how Asian people are affected differently through diabetes. So you know how BMI
Yeah.
numbers are lower because
Mm-hmm.
structure is different. There's a lot of visceral fat that's visceral fat in the sense of like around your organs that a lot of Asian people carry but don't
Okay,
know. So,
interesting.
and I think some of the assumption, which I had the assumption too, is like, oh, when you're bigger or more structured
Mm-hmm.
or way more, that you're more prone for diabetes.
Right.
But it could be anybody. But genetically and through evolution, like just the Asian, the way we're built and the way our diets are, all of that affects it. So
Yeah.
when I think about you saying that, like if I were to go to a provider who is maybe of an Asian
Like looks
ethnicity,
like you.
could
Yeah.
could definitely understand more. That could like oversee
Yeah.
something that like a maybe somebody
Just
that's
more
not,
nuance
yeah,
about
or just
those
awareness of
specific
that.
things. Yeah. And I feel like for me, my choices have just like naturally, as in providers, have just naturally come from like wanting to interact with people who look differently than me. But like I said, I feel like I've found, again, I don't want to generalize, that they are just like more in tune with questions and emotions. So,
Isn't it great when we have the ability to make choices and be
yes.
intentional about
And get a mouth guard.
it?
Get a mouth guard. Well,
Well,
thanks.
now I have this line
Yeah,
that,
and that's kind of doing the same maybe
yeah,
job of like keeping your teeth from grinding on each other, and that's like the point of the mouth guard.
yeah, I should have done a long time because it would save me thousands of dollars. But this is a life learning lesson.
Yeah, right. Now we're in our 30s or however old. Thanks for listening to us talk about the dentist.
Yes. Oh wait, I know to pause
We're
this.
gonna stop recording.